The rhythmic squeak of a titanium crutch against hospital linoleum was usually the only warning the trauma bay had before Abigail arrived. The doctors called her a crippled liability. They didn't know the gruesome scars on her leg came from a classified blast in Kandahar, or that the federal government was currently tearing the state apart looking for her. The fluorescent lights of Harborview Medical Center in downtown Seattle buzzed with a relentless sterile hum, casting long, pale shadows across the Level 1 trauma bay. It was 2:15 a.m. on a torrential Tuesday morning, the kind of relentless Pacific Northwest rain that inevitably brought shattered glass and twisted metal through the emergency room doors. Abigail Mitchell leaned heavily against the polished aluminum of the nurse's station, her right hand gripping a custom forearm crutch. At 34, Abigail looked older, her face weathered by a lifetime of experiences she was legally forbidden to discuss. She wore standard navy blue scrubs cut specifically to accommodate the heavy, custom-fitted orthopedic brace that caged her shattered left leg. A long-sleeved thermal undershirt hid the extensive, pale pink burn grafts that snaked up her left arm and disappeared beneath her collar. "Mitchell, can you actually move faster, or is that clicking sound just for dramatic effect?" The voice belonged to Dr. Gregory Harrison, the chief trauma resident. He was 32, wore an impeccably ironed white coat, and possessed the kind of unearned arrogance that only came from a lifetime of trust funds and private academies. He was currently reviewing a chart, not even bothering to look up, as Abigail limped past him to restock the intubation trays. "I'm moving at the speed of efficiency, Dr. Harrison." Abigail replied, her voice a calm, gravelly baritone that rarely fluctuated. Dr. Chloe Weber, a first-year surgical resident who shadowed Harrison like an eager satellite, let out a short, derisive snort. "Efficiency. You took 3 minutes to cross the hallway with those trauma shears. If we had a coding patient, they'd be dead by the time you dragged yourself to the striker bed." Abigail didn't look at them. She methodically sorted the laryngoscope blades, her hands moving with a fluid mechanical precision that completely defied the broken nature of her lower body. She had spent the last 3 years in this hospital, enduring the snide remarks, the eye rolls, and the blatant disrespect. To them, she was a broken civilian, a charity hire forced upon the hospital by some obscure equal opportunity employment mandate. They didn't know about the 15 years she had spent in the United States Army, the last 8 of which were completely scrubbed from all public Department of Defense databases. They didn't know about Joint Special Operations Command, or the highly classified Quick Reaction Medical Extraction Unit she had led under the code name Iron Raven. They only saw a woman who couldn't walk without a cane. Suddenly, the overhead trauma radio crackled to life, the dispatcher's voice cutting through the ambient noise of the ER. "Harborview Base, this is Medic 44. We are 3 minutes out with a priority 1 trauma. 30-year-old male unrestrained driver in a high-speed rollover on Interstate 5. Patient is tachycardic, hypotensive, altered mental status. Significant blunt force trauma to the chest and a compound fracture of the right femur." The trauma bay erupted into organized chaos. Harrison clapped his hands together, his eyes wide with the adrenaline rush of a major surgical case. "All right, listen up, Weber. You're on the fast exam. Let's get 2 large-bore IVs O-negative blood ready on the rapid infuser." "Mitchell," he snapped his fingers aggressively in Abigail's direction. "Get out of the primary circle, stay by the supply cart and hand us gauze. Don't trip over your own metal leg and contaminate my sterile field. Abigail clenched her jaw, the muscles feathering along her cheek line, but she silently stepped back, her crutch thumping solidly against the tile. The double doors burst open and the paramedics rushed in, pushing a blood-slicked gurney. The patient was thrashing weakly, his skin a terrifying shade of ashen gray. Harrison immediately took charge, shouting orders, as the team transferred the man to the trauma bed. Heart rate is 140, blood pressure is tanking 80/50. A nurse yelled over the din. "It's the femur, he's bleeding out into his thigh," Harrison declared, quickly palpating the mangled leg. "Weber, get the tourniquet higher. Push 2 liters of lactated ringers." From her position by the supply cart, Abigail's eyes scanned the patient. Her mind, conditioned by years of operating in pitch-black combat zones under heavy enemy fire, processed data differently than the civilians in the room. She looked past the obvious distraction of the bloody leg. She noticed the distended jugular veins pulsing wildly on the man's neck. She saw the paradoxically muted movement of his chest, and though she didn't have a stethoscope, the monitor's specific waveform told a deadly story. "Dr. Harrison," Abigail said, her voice cutting cleanly through the panic. "His neck veins are distended, and his pressure is dropping despite the fluids. He has Beck's triad. It's not just the leg. He has cardiac tamponade. His heart is being crushed by fluid." Harrison whirled around his face, flushed with fury. "Did I ask for a diagnostic opinion from the supply closet? He has a shattered femur. You idiot. He's hypovolemic. Look at the monitor." Abigail insisted, taking a step forward, her crutch planting firmly on the floor. "Electrical alternans. The QRS complexes are changing height. His heart is swimming in blood. If you don't decompress his chest right now, he will arrest in less than 60 seconds. "Security!" Harrison shouted, completely losing his temper. "Get this crippled nurse out of my trauma bay. Weber, prep him for an emergency X-lap. We are taking him to the OR. He won't make it to the elevator," Abigail warned, her voice dropping to a terrifyingly cold register. Exactly 42 seconds later, the jarring high-pitched tone of the heart monitor flatlined. A solid, uninterrupted green line screamed across the screen. "Patient has lost a pulse," Weber shrieked, backing away from the bed in sudden terror. "He's in PEA arrest." Harrison froze. The arrogance entirely evaporated from his face, replaced by the hollow deer-in-the-headlights paralysis of a man who realized he had just made a fatal mistake. He stared at the flat line, his hands hovering uselessly over the patient's ruined leg. "Push epi," he stammered weakly. "Start compressions." "Compressions won't work on an empty heart," Abigail growled. Before Harrison could react, Abigail moved. The lethargy and slowness she usually displayed vanished. She dropped her forearm crutch, letting it clatter loudly onto the floor. Shifting her entire weight onto her healthy right leg, she lunged toward the trauma tray. Her left hand, scarred but incredibly steady, snatched a massive 6-inch spinal needle and a large syringe. "Mitchell, what are you doing? Step away from the patient," Harrison screamed, snapping out of his freeze to try and physically block her. Abigail drove her elbow backward, catching Harrison squarely in the sternum. It wasn't a violent strike, but it carried the absolute immovable physics of a trained combatant. Harrison gasped and stumbled backward, crashing into a rolling monitor. Leaning heavily against the bed to support her ruined leg, Abigail located the xiphoid process at the bottom of the patient's sternum. Without hesitation, Without an ultrasound to guide her, she drove the massive needle upward at a sharp 45-degree angle, aiming directly for the patient's left shoulder. It was a blind pericardiocentesis, a desperate, brutal battlefield maneuver that took years to master. Weber gasped in horror. "You're piercing his heart." Abigail ignored her, pulling back on the syringe plunger. Instantly, the plastic tube filled with dark, non-clotting blood. She had successfully hit the pericardial sac. She drew out 50 milliliters of blood, relieving the crushing pressure on the cardiac muscle. Within 5 seconds, the flat line on the monitor flickered, jumped, and suddenly spiked into a rapid, life-sustaining sinus tachycardia rhythm. The patient gasped a rattling intake of air, and his blood pressure began to climb immediately. The trauma bay fell dead silent, save for the rhythmic beeping of the newly restored heartbeat. Abigail slowly withdrew the needle, engaged the safety mechanism, and dropped it into the sharps container. She leaned down, picked up her crutch from the floor, and strapped it back onto her forearm. Harrison, recovering his breath, pushed himself off the equipment cart. His face was a mask of absolute humiliation and rage. The fact that a disabled lowest-tier floor nurse had just flawlessly executed a blind cardiac intervention and saved a life he was actively losing was a profound strike against his ego. "You are done," Harrison whispered, his voice trembling with venom. He pointed a trembling finger at her. "You assaulted a superior. You performed an unauthorized surgical procedure outside your scope of practice. I am going to have the medical board strip your license, Mitchell. You will never work in medicine again. Get out of my ER now." Abigail looked at him, her expression completely devoid of emotion. She turned and began the slow, rhythmic limp toward the automatic doors leading to the ambulance bay, needing to escape the suffocating tension of the room. She didn't make it to the doors. Before she was halfway across the waiting area, a thunderous mechanical roar shook the thick glass of the hospital's entrance. The sound of high-performance engines and screaming tires echoed through the concrete drop-off zone. Through the rain-streaked windows, the hospital staff watched in stunned disbelief as a convoy of 4 massive matte black Chevrolet Suburbans abruptly jumped the curb, completely blocking the ambulance lane. The vehicles possessed heavy reinforced steel push bumpers, run-flat tires, and completely blacked-out windows. They bore no state license plates, only stark white government barcodes. "What in the hell is that?" Weber muttered, stepping out of the trauma bay. The doors of the Suburbans flew open simultaneously. Out poured a dozen men in heavy tactical gear. They wore no police badges, no FBI windbreakers. They were clad in adaptive camouflage heavy ceramic plate carriers and carried suppressed Daniel Defense MK-18 rifles slung tight across their chests. The only identifying markers on their gear were subdued infrared American flags and intricate shield-shaped patches belonging to the Joint Special Operations Command. The hospital security guards, 2 retired cops holding flashlights, took one look at the heavily armed paramilitary force flooding into the lobby and immediately backed away, raising their hands in silent surrender. The tactical operators moved with terrifying silent efficiency. They immediately secured all exits, standing like statues by the automatic doors, their eyes scanning the room behind dark tactical glasses. From the lead SUV, a man stepped out into the Seattle rain. He wasn't wearing tactical gear. He wore a sharply tailored charcoal suit covered by a dark wool overcoat. He had iron gray hair, piercing blue eyes, and carried an aura of absolute, unquestionable authority. He walked through the sliding glass doors, the water dripping from his shoulders onto the linoleum. The ER went entirely silent. Even the groans of the patients seemed to hush in the presence of the intruders. Harrison, desperately trying to reclaim his shattered authority, puffed out his chest and marched toward the man in the suit. "Excuse me, this is a secure medical facility. You cannot bring weapons in here. I don't care what alphabet agency you belong to. I am the chief resident, and I demand you leave before I call the police." The man in the suit didn't even blink. He didn't break his stride. He simply raised a hand, and two massive operators instantly stepped forward, physically boxing Harrison out of the path, like he was nothing more than an inconvenient piece of furniture. Harrison stumbled back, his mouth opening and closing in shock. The man in the suit stopped in the dead center of the emergency room. His eyes swept over the terrified doctors, the confused nurses, and the bewildered patients. "I am Commander David Vance. No rewrite. I am Commander Robert Sterling. No band names check. No Sterling, no Vance. I am Director Jonathan Reed of the Department of Defense." The man announced, his voice echoing off the tile walls with chilling clarity. He didn't shout, but the command in his tone commanded absolute obedience. "We are locking down this facility under federal authority." He paused, his eyes narrowing as he scanned the faces of the medical staff. "I am looking for a highly classified asset." Director Reed stated, his gaze finally locking onto a figure standing quietly in the shadows near the supply carts. "We are looking for Iron Raven." The silence that followed Director Jonathan Reed's declaration was absolute heavy enough to crush the breath from the lungs of every civilian in the room. The trauma bay, usually a sanctuary of controlled medical chaos, had been instantly transformed into a militarized staging ground. The tactical operators from the Joint Special Operations Command held their perimeters with statuesque discipline, their suppressed MK-18 carbines resting at the low ready. Dr. Gregory Harrison, still clutching his chest where Abigail had forcefully shoved him, let out a nervous, incredulous laugh. The sound echoed awkwardly against the sterile tiles. "Iron what look, Director? I don't know what kind of federal training exercise this is, but you have the wrong hospital. We don't have any classified operatives here. You're pointing at Abigail Mitchell. She's a disabled floor nurse. She just violently assaulted me and performed a rogue needle decompression. I was literally just about to call security to have her fired." Director Reed slowly turned his head. His icy blue eyes locked onto the chief resident with the kind of predatory stillness that made Harrison's nervous smile vanish instantly. "Doctor," Reed said, his voice dropping to a dangerously quiet register, "if you speak again without my explicit permission, I will have my operators physically secure your mouth with military-grade flex cuffs. Do you understand me?" Harrison swallowed hard, his face draining of all color. He took a staggering step backward, raising his hands in a gesture of submission, completely emasculated in front of his entire surgical staff. Dr. Chloe Weber shrank against the supply cabinets, her eyes wide with unadulterated terror. Reed turned his attention back to the shadows near the medication dispensary. He took 3 deliberate steps forward, stopping exactly 6 feet away from the woman leaning heavily on her titanium forearm crutch. "Captain Mitchell," Reed said, his tone softening only fractionally, carrying an undeniable undercurrent of deep respect. Abigail stepped forward into the harsh, fluorescent light. She didn't look surprised. She didn't look intimidated. The weary, subservient posture she had maintained for 3 years at Harborview Medical Center evaporated. She stood taller, her spine perfectly straight, projecting an aura of lethal competence that made the surrounding doctors look like frightened children. "It's been a long time, Director," Abigail replied, her gravelly baritone steady and completely unfazed. "My military records were scrubbed by the Pentagon. Iron Raven hasn't existed since the extraction in the Helmand province 3 years ago. I am a civilian now. Circumstances have bypassed your retirement, Captain," Reed stated bluntly. 45 minutes ago, a highly classified domestic counterterrorism raid went catastrophically wrong at a warehouse near the port of Tacoma. An elite containment team was compromised by a volatile experimental neurotoxin laced with an anticoagulant. The local blast also caused severe kinetic trauma. "Take them to Madigan Army Medical Center," Abigail countered immediately. "They have the facilities for NBC protocol." "We can't," Reed replied, his jaw tightening. "The airspace is entirely grounded due to the storm, and Madigan is 40 miles away. The asset won't survive the drive. Furthermore, standard trauma surgeons do not have the clearance nor the battlefield training to handle this specific chemical compound. You wrote the original JSOC medical doctrine on this exact hemorrhagic neurotoxin, Captain. You are the only surgeon on the West Coast who knows how to keep this man alive." Harrison, unable to control his bruised ego, choked out a sound of disbelief. "Surgeon, she's a nurse. She can barely walk." One of the operators standing near the doors subtly shifted his rifle. The metallic clack of the weapon's safety being disengaged sounded like a thunderclap in the quiet room. Harrison instantly clamped his mouth shut. "Bring him in," Reed barked into a tactical radio attached to his lapel. The double doors leading to the ambulance bay blew open. 4 more JSOC operators sprinted into the room, pushing a military-grade titanium transport litter. The man on the stretcher was wearing a ruined Crye Precision combat uniform, heavily soaked in dark arterial red. He was thrashing, violently seizing as the neurotoxin attacked his central nervous system, while massive amounts of blood poured from a catastrophic shrapnel wound in his right shoulder and neck. Abigail's eyes locked onto the patient. The civilian hospital vanished from her mind. The crippling pain in her shattered left leg faded into irrelevant background noise. She recognized the dying man instantly. It was Major John Sullivan, her former commanding officer from Delta Force. Without waiting for permission, without looking at the bewildered hospital administrators who were now creeping into the hallway, Abigail dropped her crutch. She didn't need it. The adrenaline of the combat environment overrode her damaged nerves. She limped rapidly to the head of the bed, her hands instantly flying over Sullivan's ruined neck, applying targeted crushing pressure to the severed carotid artery. "Talk to me," Abigail barked, her voice echoing with absolute authority. "Pulse is threading at 160. Pressure is 60, palpated." A JSOC combat medic shouted, running alongside the litter. "Tourniquets have failed due to the axillary placement of the shrapnel. The toxin is causing massive disseminated intravascular coagulation. He's bleeding from his eyes, Captain." Mike teamed Forin. Abigail looked up, her gaze sweeping across the paralyzed civilian medical staff. "I need an operating room right now. I need Reboa kits. I need 50 units of O-negative blood, tranexamic acid, and every vial of calcium gluconate you have in the pharmacy." When no one moved, Abigail slammed her bloody fist against the metal railing of the litter. "Move!" she roared, a terrifying guttural command that shook the glass partitions. Harrison flinched as if he had been struck. "You can't commandeer my trauma center!" Director Reed stepped directly into Harrison's personal space, pulling a thick leather folder from his overcoat and slamming it directly into the chief resident's chest. "By order of the United States Department of Defense, Harborview Medical Center is now a federal military asset. Captain Abigail Mitchell is in absolute command of this facility. You will follow her orders, Doctor, or I will have you arrested for treason." The transition from a civilian emergency room to a military surgical theater happened in less than 90 seconds. Under the terrifying gaze of the federal operators, the Harborview staff scrambled with a desperate, frantic energy they had never exhibited before. Abigail Mitchell stripped off her bloody scrub top right in the middle of the hallway, revealing a form-fitting gray tactical undershirt. A massive, jagged scar, the remnants of an improvised explosive device that had ended her military career, tore across her left shoulder down to her ribs. The doctors and nurses who had whispered cruel jokes about her limp now stared in silent awe at the roadmap of violence etched into her flesh. "Weber!" Abigail shouted, scrubbing her hands aggressively at the surgical sink, while keeping her eyes locked on Sullivan through the glass window of OR1. "You are my secondary assist. Get gowned up." Dr. Chloe Weber, shaking like a leaf, fumbled with her surgical mask. "Yes, Captain." "Harrison," Abigail snapped. The chief resident, who had been stripped of his authority, his pride and his arrogance in the span of 10 minutes, stepped forward hesitantly. His perfectly ironed white coat was now splattered with the blood of the patient Abigail had saved earlier. "You are going to run the rapid infuser." Abigail commanded, her voice cold and completely detached. "You will not touch a scalpel. You will not offer diagnostic opinions. You will squeeze bags of blood into this man's veins until I tell you to stop. If you fail, he dies, and Director Reed will ensure you spend the rest of your life in Leavenworth. Do we have a clear understanding?" Harrison swallowed his throat completely dry. He looked at the JSOC operators flanking the operating room doors. "Yes, ma'am." Inside the blindingly bright operating room, the situation was catastrophic. Major Sullivan was bleeding out from the shrapnel wound, but the experimental neurotoxin was preventing his blood from clotting. It was a surgical nightmare that required speed precision and an absolute disregard for standard civilian protocols. "Patient is in ventricular tachycardia," the JSOC medic warned, watching the monitors. "Toxin is attacking the myocardium. Weber, clamp the subclavian artery." Abigail ordered, stepping up to the table. She didn't wait for the anesthesiologist to finish perfectly draping the patient. She took a number 10 scalpel and made a massive, aggressive incision across Sullivan's chest. It wasn't delicate. It was a brutal, life-saving maneuver designed for the chaos of a battlefield. Weber's hands were shaking violently. "I can't see the artery. There's too much blood. Breathe, Weber." Abigail said, her voice suddenly dropping the harsh command tone, shifting into the calm, grounding cadence of a seasoned combat instructor. "Stop looking at the blood. Look at the anatomy. Find the clavicle tract inferiorly. Use your fingers, not your eyes. Feel the pulse." Weber took a ragged breath, plunged her hands into the surgical field, and blindly searched. A second later, her eyes widened. "I have it, I feel the pulse." "Clamp it down hard," Abigail instructed. Harrison pushed 2 grams of TXA and hit him with the calcium gluconate. We need to reverse the anticoagulant effect of the toxin before I repair the vessel. For the next 45 minutes, the operating room was a masterclass in extreme trauma surgery. The doctors who had mocked Abigail for being slow and crippled watched in absolute stunned silence as her hands moved like lightning. She navigated the shredded vascular tissue of Sullivan's neck with a terrifying brilliance. She didn't hesitate. She didn't second guess. She executed complex suturing techniques that Harrison had only read about in experimental medical journals. Through sheer willpower, aggressive chemical countermeasures, and flawless surgical precision, the bleeding finally stopped. The heart monitor, which had been screaming a chaotic, erratic rhythm for almost an hour, slowly settled into a strong, steady sinus rhythm. "Vitals are stabilizing," the JSOC medic reported, wiping sweat from his forehead. "Pressure is climbing. Toxin levels in the blood are degrading. He's going to make it, Captain." Abigail stepped back from the operating table. The adrenaline spike was beginning to fade, and the agonizing, burning pain in her shattered leg came rushing back. She stumbled slightly. Instantly, an operator was at her side, handing her the titanium crutch she had abandoned in the hallway. She took it, leaning heavily onto the metal, her chest heaving. Harrison stood by the fluid pumps, his hands stained with blood, his face pale and completely humbled. He looked at the disabled nurse he had treated like garbage for 3 years, finally understanding the absolute magnitude of the woman standing before him. Director Reed stepped into the operating room. He looked at the stabilized patient, then turned to Abigail. He reached into his suit jacket and pulled out a heavy dark blue velvet box, holding it out to her. "The president signed the executive order 20 minutes ago," Reed said quietly, so only she could hear. "Your medical discharge has been reversed. Your security clearance is reinstated at level Alpha. The Iron Raven operational detachment is being reactivated. We need our chief medical officer back, Abigail." Abigail looked at the velvet box. Inside rested the silver oak leaves of a lieutenant colonel. She slowly reached out and took the box, closing it with a sharp, decisive snap. She turned toward the doors, her crutch clicking against the bloody tile. As she passed Harrison, she didn't gloat. She didn't demand an apology. She simply looked at him with the cold, pitying gaze of a wolf looking at a frightened house dog. "Keep his fluids balanced, doctor," Abigail said quietly. "I'll be back for my patient in the morning." She walked out of the operating room, flanked by heavily armed federal operators, leaving her bloody scrubs on the floor and leaving the arrogant hierarchy of Harborview Medical Center completely and utterly destroyed in her wake. The truth about Abigail's past had finally caught up to her, transforming a hospital of arrogant doctors into witnesses of absolute power. What happens when the military's most elite and dangerous medical operative is called back to the front lines? The hospital hierarchy is about to be completely destroyed. If you want to hear the jaw-dropping conclusion of Iron Raven's return in parts 3 and 4, make sure to like this video, leave a comment down below, and subscribe to the channel so you never miss a story.